Thank you, Mr. Speaker. My question is to the Minister of Health and Long-Term Care. 1 out of every 8 Canadian women is being diagnosed with breast cancer, and 30% of all breast cancers become metastatic. Luckily, there are treatments available that help to keep the disease under control and help these women live better, longer lives. Unfortunately, negotiations to get these medications covered by our healthcare system can go on for over a year without any updates. Patients in desperate need of these drugs are being left in the dark waiting. But cancer does not wait, Mr. Speaker. Last year, the ministry said that an announcement to make the process more accountable to patients would be forthcoming. When can we finally expect the announcement from this minister?
Thank you, Minister of Health, Long-Term Care.
Well, thank you very much, Mr. Speaker, and certainly we know that there is great progress made in the treatment of breast cancer, and our government has obviously been very active in this particular area with the Ontario Breast Screening Program and obviously new and enhanced treatments for patients. In terms of cancer drugs in general, I would remind the member opposite that we have an evidence-based system here in Ontario. We believe that clearly we need medical expertise in terms of effectiveness, side effects, and of course we're part of a national program as well to analyze new and emerging treatments and drugs. And so we take this responsibility very seriously. We have taken the politics out of these decisions, and we will continue to do so. We believe in obviously ensuring that we do a thorough analysis and we make our choices based on evidence. Thank you, Mr. Speaker.
Thank you. Supplementary.
Thank you, Mr. Speaker. Back to the minister. In similar jurisdictions, we see more transparency and more timely benchmarks in the negotiation process, which helps government prepare recommendations to pharmaceutical companies. For example, if the price of a drug is too high or it doesn't meet certain conditions, the negotiators know what needs to change and they get back to the table quickly. Last October, I tabled a petition launched by Rethink Breast Cancer that has since received over 10,000 signatures calling on Ontario to take the lead in fixing this process. So once again, my question to the minister on behalf of the signatories, the breast cancer patients and their families is, what have you done to make the negotiation process accountable, and when are you going to put proper deadlines in place so that Ontario cancer patients get the treatments that they need?
Thank you. Minister.
Well, thank you, Mr. Speaker. And as I've said several times in this House, we will continue to analyze data. We will obviously encourage all the experts that are involved in the processes, whether at the national level or here in Ontario, to do their work in an expeditious fashion. When it comes to negotiations, obviously, we will be part of the national system in terms of bulk purchasing, which will have the potential, obviously, to drive costs down. We're on top of the situation, Mr. Speaker. We are working very, very hard in this regard, and I think overall the member opposite and I share the need to move as fast as we can and in the best interests of Ontarians. We're working all the time in the public interest, Mr. Speaker.
Thank you.